Hello, I'm Ulf Pape from Germany. I will show you a treatment for patients with neck pain and primary headache against migraine, tension headache, and cervical headache. We start with gentle strokes of the neck, starting at the level of the upper thoracic spine. Pull the hands alternately over the neck and over the occiput. While doing this, I have a light traction pull. It's important that you pull over the nuque line. In the next step, follows the second technique. I pull my fingertips on both sides over the transverse processes of the upper thoracic vertebral, the cervical vertebral, over the back of the head. While doing this, I lift the patient's head slightly. The fingertips, not my fingernails, melt deeply into the myofascial tissue. My hands are slightly shaped into a claw. You see it? I melt very, very deeply in the myofascial tissue. After this, followed by 1 or 2 gentle strokes again. Gentle strokes follow, you see it. After this, followed by 1 or 2 gentle strokes again. I place all my fingertips below the upper cervical muscles. These muscles affect very small head movements. The patient should lose the head that the head is heavy, the neck is relaxed. Then I begin to apply a minimal friction with my fingers in the area of the foramen magnus. After this, my fingers are positioned there passive again. I give the order to the patient to perform minimal active inclinations, reclinations, lateral flexions, and rotations. This maneuver often results in atlas correction. I tell the patient to move according to her abilities and needs. The patient herself determines the adequate pressure. You see it? Rotations, minimal lateral flexions, inclinations, reclinations. Here, inclinations, reclinations. Following a short, gentle stroking again. In the next step, I tilt down the head part of the massage bench. I bring both hands into the so-called pistol grip. My index fingers splint the cervical spine. The other fingers are below the head joint muscles. My 2 thumbs are placed above the ears. Now I perform a sliding mobilization on the transversal plane. Without forcing anything, I move the patient's head as far as possible, parallel to the patient's shoulders to the left and right. I have the opportunity to bend the fingers a little and can apply light acupressure bilaterally on the upper transverse processes of the cervical spine. Then I perform a sliding mobilization of the sagittal plane. My hand, which is below the skull, is positioned so that the back of the patient's head rests on the ball of my hand. My fingers are again positioned below the head joint muscles. The ball of my other hand is on the patient's forehand. The large finger of the hand above is on the patient's shin dimple. I move the head up and down as far as possible, paying attention to the sagittal plane. Do not bring the head into flexion. We want to achieve a sliding mobilization on the sagittal plane. It's not a flexion. In the next step, we do more intensive myofascial maneuvers. When you do this, you place the patient's head in the lateral position. If the patient can place her hand under her head without effort or restriction, you should prefer this position. First, I lift her arm so that I can get my fingers beneath her back. I form my hand into a claw. Place my cloned hand with the fingers extended upwards far under the thoracic spine below the ends of the transverse processes. My patient rests on my fingers with their own weight. I pull my fingers headwards. I'm melting very slowly into the myofascial tissue. At the same time, I press her shoulder downwards. The fascial stroke ends above the nucleus line on the occiput. In this position, the fascial melting massage strokes start over the arm, then over the shoulder, following over the muscle belly of the descendant trapezius muscle until above the nuchal line. I let my fingers melt very deeply over the muscle belly of the trapezius muscle. The area of the second third between the acromion and the neck dwell few seconds and press my fingers downwards. There is the important Chinese acupuncture point, gallbladder 21. This point is very effective against headache and shoulder pain. This point can also be a trigger point or a tender point of the trapezius muscle. If there is trigger point activity, the pain radiates to the neck and head and/or to the acromion. Then I glide continue over the occiput and slide further above the occiput. After this direction, I glide in the opposite direction from the head to the upper arm. In the next step, I pull melting over a further line. I start again on the upper arm, melt slowly over the greater tuberosity, melt into the supraspinatus muscle, then over the levator scapulae muscle to the occiput, and then lateral over the insertions of the sternocleidomastoid muscle. Near the insertion of the levator scapulae muscle is the Chinese acupuncture point, intestine 14. The point can also be a potential trigger point of the levator scapulae muscle. This acupuncture point has similar properties like the Chinese acupuncture point, gallbladder 21. Following, we treat acupressure and trigger point areas of the sternocleidomastoid muscle. The trigger points of this muscle can radiate pain into the face region when active, especially in the area of the eyes and temples. When patients suffering from migraine, this muscle is very often hardened and should therefore be treated as well. Never press into this muscle with pointed or deep pressure. This can lead severe damages. For this reason, we work here with pinching acupressure. I pinch slowly this whole head-turning muscle, thumb width by thumb width, in the direction of the sternal and clavicular muscle insertions. After, you can work upwards too. If you can't get good grip in the muscle, you should lift the head slightly. Some people find this specific treatment unpleasant or pleasant. For many patients, the sensation is often between pleasant and comfortable. Therefore, you should explain the patient why you treat this muscle. The same applies to other sensitive areas. This part of treatment is often successful in cases of whiplash or problems with the lower jaw. In many cases, pain in the neck and cervical muscles can be a contributing factor to migraine. In the next step, I acupressure the side of the skull while moving the scalp a little. In addition, you could now treat the Chinese meridian line and their acupressure points. I do not show that here. I could also integrate an intensive treatment of the entire jaw muscles in this position. Now I stroke the neck muscles again in both directions. Always I stroke out far the muscles regions and muscles insertions because superficial myofascial trains do not end to the insertions. I recommend this treatment also for shoulder and back problems because the neck region is almost a part of the problem. This positioning of patient is also very practical when working on a mat. If you do a Shiatsu or Thai treatment, in this way the therapist can develop from the center of gravity and must not bend his back. Now I do the basic techniques again on the other side. In a real treatment, you should work very slowly. I start with the vertebral fascial technique from the middle transverse processes of the thoracic spine to above the occiput. While this maneuver, you press the patient's shoulder into the depression. Then follows the long fascial stroke with the focus on the trapezius muscle. Treat in one and the other direction. Then follows the second long fascial strokes with the focus of the supraspinatus and levator scapulae muscle. This fascial stroke ends above the muscle insertion of the sternocleidomastoid muscle. And now upwards. Be careful, don't hurt the patient's hair roots. Over the insertions, always over the insertions to the upper arm. If you have the option, then work as far as possible over many joints and especially insertion areas. In the next step, I will show as a footnote a small acupressure combination against headache. The one Chinese acupuncture point, bladder 2, is located from the medial thumbs 1 fingertip wide above the eyebrow. There is also a nerve end of the trigeminal nerve. The other point, bladder 10, is located on the same side above the transverse atlas. You press both acupuncture points in the same time for 1 until 2 minutes. During this acupressure, often a little pain shoots into the head. This acupressure combination is also very often successful against occipital neuralgia. There are many other acupuncture points combinations against headache. That is only one example. You can find many such combinations in acupuncture books. Acupressure and fascial treatment combined is often very effective. Don't forget also on this side the pinching acupressure of the sternocleidomastoid muscle. It's also possible to integrate the treatment other muscles of the neck. For example, the treatment of potential trigger points of the scalene muscles can be integrated into the treatment. Fascial traction below the collarbone towards the shoulder can have also a detonating effect on the whole neck, shoulder and head region. In short, I have a very wide range of therapeutic action possibilities in this positioning. On the bent arm of the other side, you could also treat the Chinese heart meridian below the belly of the bicep muscle. This treatment part is often a positive effect on the circulation and breathing. The patient breathes more deeply and is more relaxed. The lateral head acupressure points and meridians are important. At the end, you gently stroke the neck again as at the beginning. Gently I end the treatment. Thank you for your attention. Okay, that is the end. I hope I see you again. Goodbye.